Hi, I'm Arya Sharma. I'm the scientific director of Obesity Canada, which, as you probably know, is Canada's national registered charity dedicated to improving the lives of Canadians through obesity research, education, and advocacy. Through its work, Obesity Canada educates health professionals, supports researchers, mentors trainees and students, and works closely with policymakers to ensure that all Canadians living with obesity receive the same level of prevention and care as Canadians living with other chronic diseases like diabetes or hypertension. Now, we realize that in this time of COVID-19, with everybody stuck at home, uh, not only have we learned that COVID-19 poses particular risks for people living with obesity, but we also understand that for many people living with obesity who are trying to manage their weight, uh, this time of staying at home can provide numerous challenges, especially when it comes to eating behaviors. So today on the show, I'd like to welcome Jennifer Brown, who's a registered dietitian, works at the Ottawa Hospital Bariatric Program. Uh, Jennifer, nice to have you on this chat.
Great. Thanks a lot, Dr. Sharma, and thanks for having me on the chat today.
So Jennifer, tell us a little bit about your practice, and perhaps we can start actually with your role in Obesity Canada, because you're very active in this organization and have been for a long time.
Yeah, I've been lucky enough to be a member of Obesity Canada for, well, I guess it's been over 10 years. 2006, I think, was when you first started, so that's when I joined. Right now, I'm playing both an advocacy role, so I'm the clinical or the coordinator for the Canadian Obesity Advocacy Network, which is an advocating group across Canada. I'm also on the Obesity Canada Clinical Steering Committee, as well as the clinical or the Population Health Policy Health Promotion Committee. In the last few years, I've also been a steering committee member and lead author on the clinical practice guidelines that are coming out later this year. So specifically for the nutrition chapter. And then all my work at the Ottawa Hospital Bariatric Center of Excellence as a dietitian working in more clinical practice.
So since we started these chats, we've been receiving a lot of questions from from people who follow Obesity Canada. And one of the questions that has come up was from a patient who says that, I've recently had bariatric surgery just before the lockdown. And now she's apparently worried on how she can maintain her post-operation diet while in isolation. So what would you have to
Yeah,
tell
so
someone like
I
that?
mean, lucky enough that I've been able to be working from home during this time. So I'm still doing a lot of counseling and phone calls and virtual calls with our clients. And that's pretty much everybody's question is how do I help, how do I maintain everything afterwards? Um, I mean, the first thing I want to tell everybody, if you've had surgery, whether it's recent or quite some time ago, maybe reaching out to the center that you had your surgery from. And if you're still a client or a patient there, just connecting with the team. If you haven't seen a dietitian or a nurse or a doctor or any of the health providers, maybe reaching out at this time is not a bad idea to just ask them any questions you might have and any worries that you have so you can get a bit more individualized care. I also would recommend maybe looking at some of the resources that you've had. I mean, most programs give out quite extensive amounts of handouts and booklets and information. So maybe having a chance to go through that might also help just refresh your memory and keep you focused. But I think right now I do want to acknowledge that it is a really difficult time for a lot of folks. And so just to be kind to yourself and to not overly think too much about it. I think we're all going through this together. So it's just really good time to reach out, get support if you need it, and ask for help.
And as always, we've always talked about the importance of self-monitoring and keeping food records and having a journal. And I think that might be something that's particularly important when you're in a time like this. Is
Yeah,
that
it,
correct?
it can be for some, definitely tracking food intake, or it's not so much the food intake that might be important for people to track, but rather some of the habits, or if people are noticing that they're noticing cravings or hunger at certain times of the day, then tracking kind of what time you're eating. Are you getting enough protein, enough fiber, enough fluids? Are you eating foods that you're actually getting some enjoyment from, but also that are giving you satisfaction? I think is a really important piece right now. So tracking, yeah, the food behaviors component can help. Also tracking mood, energy level. This can be a really stressful time. So, actually monitoring your stress and how, what kind of coping strategies are you using for stress right now? And I know that might be a question we kind of get into in a little bit of what are some of those food related things we can tackle. But I think tracking in general, whether it's activity, whether it's food, whether it's, people's mood or sleep, or stress, I think those are all things that we can actually that can help us during this time rather than just focusing on the quantity of what people might be eating.
So one of the things that has come with having to stay at home for many folks is that the normal structure kind of falls apart. Otherwise, on normal days, you would leave the house at a certain time and you would have a lunch break at a certain time and you'd come back home at a certain time. And now you're at home basically 24/7. And that poses a lot of problems. First of all, it breaks down your routine so that now you can pretty much eat whenever you want. And that can probably create, as I imagine, problems both with planning and sticking to your plan, but also brings up the issue of being able to eat whenever you want, which then leads us to the topic of grazing. So let's start with the first one. Let's start with the importance of maintaining an eating routine. What's your advice there?
Yeah, I think so. Nobody has ever gone through this before. I think this is an unprecedented time in our history. And so, first off, it's normal for people's habits and routine to be shaken. And I think this is a really important time to not blame yourself and not to have any negative thoughts about it, just to be kind to yourself and realize that, yeah, this is difficult. But I think just like whether for yourself, whether for family members, if you have children, I think routine is probably the most important thing right now. So whether it's sleep routine, whether it's your eating routine, exercise routine, anything that can help with your just, feeling good at this point is going to be helpful. So when it comes to the food, I think trying to stick to what works for you. So if you enjoy having something to eat within a certain time frame of waking up, try to stick to that on a regular basis. We often recommend trying to eat every 2 to 4 hours, depending on the person. So doing your best to do that.
Now, again, as a reminder, now that this is specific advice for people who've had bariatric surgery, and we'll probably get to people who haven't had bariatric surgery in a minute. But the advice that you're giving, eat every 2, 3, 4 hours, that's the kind of advice you would give to someone who's had bariatric surgery. Is that correct?
Yeah, everybody's different. So whether someone's had surgery or not, I tend to use, if we're using blanket nutrition statements, those are some of the common statements I might suggest for some folks. But it really depends from person to person. And I think that's why, I've been lucky now to be doing some virtual care and telephone care with patients to be able to talk to them about what would work best for them. So some people it's every 4 or 5 hours, some people it's every 2 or 3 hours. It really depends on the person. But yeah, kind of going back to what you said, it's a lot of it is just building in that routine. So whether you're somebody who's really busy, I know a lot of parents right now are trying to learn how to teach their kids because their kids are out of school. So maybe just getting even the kids on that routine and you following the same type of structure. So when it's break time, maybe that's the time to have a snack, or if it's a meal time, to have time for a meal. Having things planned ahead, I think now is key. And one of the things that can help during this time, I think that we can actually look at this as a positive, it bringing people back to, cooking foods at home. We're actually seeing a lot more people actually doing a lot more home cooking. And so, if you've got kids at home or if you've got a spouse at home, maybe now it's a fun time to actually learn a new recipe. If you're not really that great at cooking, there's so many virtual and online type of resources that you can use during this time. So maybe it's a matter of like learning a new recipe, trying something new. If you live at home alone, or if you're isolated and you don't have anybody with you, again, I think there's a lot of online connections that people can make right now. So looking in your community or looking online to see if there's cooking classes, or even reaching out to a friend or a family member to say, hey, let's do a virtual class and let's try making something together.
Now,
So
obviously, meal planning also means that you need to plan your grocery shopping because you're trying to avoid going to the grocery store, as often or as few times as possible. So what's your advice there? How do you plan for grocery shopping so that you can plan your
yeah.
your weekly eating plan? What's your
Yeah,
advice?
I have also struggled with this. I'm someone who tends to shop multiple times a week, so this has been a big challenge for me as well. I think for most folks, trying to limit yourself to maybe once a week, if you can, sending one person from the household to go grocery shopping. Um, Regardless of COVID-19, I think planning to go to the grocery store is always important. So it just a matter of making a list. Taking a look at some of the discounts or the flyers in your local area, see what kind of foods that fit your budget and your food preferences for your family. And then kind of just making a list. What are some protein rich foods that would work for you and your family this week? What are some vegetable and fruits and whole grains and healthy fats, and then having some room for maybe some foods that are things that you and your family like to have. And this is kind of where that baking or having, doing some home cooked, snacks or home cooked ideas are good, because a lot of times people right now are looking at convenience and non-perishable foods. Oftentimes cookies and chips become a really easy kind of go-to. And this might actually be a fun time to try recipes where you make those from scratch. And it's fun. I mean, you might enjoy the taste of them, and if you don't, well, then don't have them again. But if you do enjoy them, then it might be something fun to bring the family together and reconnect with food.
Now, because you mentioned non-perishable foods, that obviously also involves cans and frozen foods and and processed foods in general. So, what are some of the things that you might want to, you'd rather avoid when it comes to those kind of foods, or what are the things that you need to be concerned about?
Well, I think right now, I think the canned and frozen vegetables can work well. Frozen vegetables and fruits are probably a great staple for everybody right now. If you can get your hands on them, I think most stores right now are having a hard time keeping them stocked. Even if you bought some fresh fruits or vegetables when they're on sale, and you can even freeze them, and that's another way you can use them in soups, stews, smoothies. Lots of little kind of if you're baking something, you can add them if you're making cookies, you can use applesauce, you can use mashed up bananas. There's all kinds of muffin recipes out there that people can use, where you use fruit, or even beans is another way of getting non-perishable type of foods in cooking. You have to be careful a little bit for right now. We know that with COVID-19, just to kind of wipe down some of the metals, or so if you have any canned foods, just to give them a clean down with a little bit of disinfectant. But make sure that if you're doing any fruits or vegetables, that you just use water. There's a lot of misconceptions out there. People are using any type of harsh chemicals or soaps, and please don't do that right now. Just rinsing them under water and giving them a good scrub down is fine, but don't use any added soaps or disinfectants.
Yeah, that's a really an important point. Now, getting back to the actual behaviors, one of the questions that we've gotten here is about the issue of grazing,
Mhm.
because you're around food, and in fact, it might just be boredom that gets you to eat. So, what do you have to be conscious about, and what would be your tips on how to avoid or how to stop yourself from grazing?
Yeah, I think the first thing right now is realizing that everybody's under a form of stress, and our body naturally, from a stress response, is going to seek out things that are going to give us pleasure. When we're confined in our homes and we have access to food, it's completely normal for us to want to seek out foods as a way of making us feel better. Um, Grazing is a tricky one because it often, again, goes hand in hand with that timing of meals, and having the availability of foods. So some people found that they just portion out their foods a little bit more. So they might put, some foods that they tend to graze more on, they might put them into smaller little snack bags or little containers. To be honest, I think at this point, a really important feature when it comes to building better relationships with our eating habits isn't to restrict ourselves, and it isn't about what we can or can't have. I think now is a time to really rebuild some of that connection with food, and it might just be a matter of listening to our hunger and our fullness cues. eating foods, that, again, when do you feel hungry? When do you feel full? Trying to listen to those cues. But if you're finding yourself really distracted, watching a lot of TV or a lot of news, especially with stressful events, then maybe using other non-food type of coping skills is important. Getting out and doing some sort of activity, whether you can do it in your house or if you have the capacity of safely being outside to do some walking or any type of activity is important. Setting up some times where you notice that grazing gets a little bit more problematic for you. It could be a time to find another habit. Maybe it's a hobby, maybe it's, the weather's getting a bit better, so maybe it's about gardening. I'm encouraging a lot of people now and maybe to start learning how to, grow some vegetables or grow some flowers or something, and, even just on an apartment balcony or even indoors. Is another thing to kind of keep yourself busy during that time if you're finding you're eating, if the grazing behaviors aren't really nutrition, related.
So these are all very helpful tips for someone who notices that maybe some of the old eating habits are coming back and they're falling back into an old routine. How do you reach out for help if you find that this is actually happening to you and you're struggling with this? What's your advice? What are some of the resources that people can fall back upon?
Yeah, so I mean, again, working in a bariatric center of excellence, I would recommend if you've had bariatric surgery or if you're a patient of a medical a program, is to reach out to those programs. Most of us are just doing telephone or virtual care right now, so connecting with your health providers. I think there's a lot of online resources. So, looking at websites, Health Canada has a lot of resources. The Public Health Agency of Canada, your local public health websites also have details. Obesity Canada has a lot of details. As a dietitian, you can visit Dietitians of Canada. Specifically, there's a website called unlockfood.ca that has a lot of tips and resources to help people during this time. There's all kinds of resources. So I think for a lot of folks, if you're finding that stress, especially mental health is being affected right now, making sure you reach out to, if you have access to a counselor, even with your employee assistance program, if you have access that way. But there's a lot of services online right now. A lot of health professionals are offering discounted or even free services during this time. So it would be a matter of just, looking online as well and seeing, but I recommend using some of those reputable sites that I mentioned.
Now, one of the challenges that, of course, we find is that more and more people are now becoming dependent on food banks just to get their groceries and just to get their food. And obviously, when you go to a food bank, it's not like you can, you have a wide choice of things. So any advice for people who unfortunately, have to depend on food banks during this time?
Yeah, this is a really difficult time. I think food insecurity is really high across Canada in general, and then during this time, it's even worse. So definitely, a lot of the local food banks are, they are still functioning. They still have quite a lot of resources. So it would be a matter of checking in. Many of them have websites you can visit online to see, what kind of provisions they might have. If there's timelines, time of when to pick things up. There's also local, fresh fruit and vegetable type of programs. So checking in with your public health department to know what's available in your area. There's also a lot of, farmers and mom and pop type agriculture groups that are starting to come together to put together like fruit and vegetable boxes that you can order online and they'll deliver it, or you can go pick it up. So again, depending on where you are, looking online for those resources or calling your local health agency or local health, public health as a way to find out what's available to you.
Excellent. So Jennifer, if you had to summarize or you share with us perhaps your 3 most important tips to get through these times, what would those be?
Yeah, so 3 tips. I mean, number 1, I have to say, being kind to yourself. Right now, I think everybody I've been chatting with in the last few weeks is feeling overly, overwhelmed and fearing everything right now, especially when it comes to eating habits. So I think being kind to yourself and allowing yourself to eat foods that you're getting enjoyment from. Um, but the second piece to that would be to reach out for support if you're finding it more overwhelming, or if it's consuming your thoughts and your actions a little bit more. So reaching out for help. Um, and I think the third thing would be trying to, again, bringing back to, that pleasure of food and trying to reconnect with food. So whether it's learning a new recipe, whether it's maybe growing some vegetables or some fruits, but reconnecting with food, I think, is a really big part right now.
Okay. Well, thank you, Jennifer, for taking the time and talking to us about these important issues. On behalf of Obesity Canada, I would like to thank all of you for watching this chat, attending this chat. To learn more about Obesity Canada, please visit the website at obesity.ca, and you can also follow Obesity Canada on all of the social media platforms. And I know that the times are tough, but if you can afford to do so, then please consider making a donation to support this important work of Obesity Canada that is trying its best to be here during these times for you. So thank you for watching, and I'll see you again soon.